Welcome, dear all, to yet another Gyan Pravah podcast episode. So, today I invite our guest, Mr. Rishi Tandulwadkar and Dr. Sunita, ma'am. This is the wonderful, I think, initiative which you have taken. Very insightful discussions on various subjects which are very useful for the doctors as well as for the general people also. Now to introduce Madam, she is currently Fogsi President, Head of the Department and Chief of IVF and Endoscopy Center at Ruby Hall Clinic, Pune. And she is the founder and medical director of Solo IVF Clinic and
Poonam,
co-founder.
thank you. Thank you. You
Just,
introduced me
okay,
previously
just one.
also.
Okay, ma'am. So I fondly call Madam Sachin Tandulwadkar of our Foxy. She is the spiritual and visionary leader, a deeply spiritual and compassionate clinician. Dr. Sunita blends clinical excellence with human care. She firmly believes that healing extends beyond medicine. That is very important, and I feel this is what makes her different from the other crowd. As the president of Foxy, she has initiated several safe motherhood projects. As safe motherhood is very close to my heart, so I am mentioning them, including Sampurna, a program which promotes safe birthing, holistic maternal care, and dignified motherhood across India. She is working for a future where no mother is left behind. So she has various extraordinary achievements. Okay, I will not name them.
Let's move on, Poonam.
Okay, we'll move on, ma'am. So, what do you want to say about our today's subject of discussion? Aging is inevitable and suffering is optional. Do you want to say anything on that? Then I will
Yeah.
introduce
So,
Rishi.
Poonam, first of all, thank you so much. Thank you. I was not aware that Rishi was invited till I received a mail from the podcast team about this recording, and I saw Rishi's name, and then I saw your WhatsApp message, and then I came to know. Same had happened in AICOG. I was unaware that he was invited, but very important, Poonam, regenerative medicine or a preventive health. This concept has to come in India. This is not the concept of a Western country. This is a concept for a human being. When Rishi came back, when he exposed, when he told, why are you not taking stem cells to another level? I said, I don't have a time. I'm looking after only infertility portion of it. But we also realize that stem cell is a one vertical. There are many more verticals. And he made us understand. Today, those medications like NAD therapy and all are not available in India. And that's why knowledge about it was not there. When I heard for the first time, I have to do 3 days research on it. And I realized such an important molecule, why we never read about it. And believe me, Poonam, if you put NAD in ovarian aging, you will find so many publications on animals, so many studies, and now transmitted to the human beings. And you know that I'm using now NAD for ovarian aging to decrease the inflammatory aging and ROS and blah, blah, blah. But it is very important that every one of us who is viewer here watching, please understand, don't sit and try taking medicine only when you are suffering. We know that aging is going to happen. These inevitably we are going to get attacked by all things which are not good for health, which probably you will discuss, and I don't want to take it out. But is there a way? So the generation of Rishi thinks that we know our parents have suffered. We know our grandparents have suffered. We also know that the age has increased. We also know that we don't want to have that. And that's what we see for the IV therapy. I find all young generation or the young generation getting their parents. So I think you probably have chosen a very right topic, that preventive medicine is a very, very important thing, and that's where we are heading towards it. And I'm sure Rishi is more well read than even me. He gives me references. I read only those because we are so studied. While he works nearly 24/7 in this field for last couple of years. So his knowledge is absolutely stunning, though he is not a doctor. And I think that is the reason why Dr. Jaideep Tan gave him a ICOG fellowship.
Yes.
When he saw even Ajit Pawar has felicitated him, Eknath Shinde felicitated him, and for the first time, the India got G20 Best Speech Award. I think health, this is very important aspect, and I'm thankful that you have chosen this topic.
I chose
Thank
this
you.
topic, ma'am, because when I listened to the talk Rishi gave in AICOG, वो मतलब मुझे ऐसे लगा कि सब ऊपर से
समझा
निकल
ही
गई है।
नहीं. He talks about the things which are so advanced.
और
मुझे भी
मुझे
समझ
लगा कि अरे
कभी
अभी
कभी.
शुरू हुई थी, अभी जरा सा समझ में आने लगा था, खत्म भी हो गई टॉक. सो दैट वाज द रीजन आई थॉट के आई मतलब आई शुड हैव दिस.
Thank you. And as the protocol says, Rish, we
So
join to welcome the faculty, and then you both are, once she introduces you, you both remain in a podcast series.
Yeah.
Both of you have a great dialogue, and I'll be joining from the viewers link for the same.
okay, ma'am.
Okay. Thank you.
Okay. So just to introduce Rishi, he is Bachelor of Science and Mechanical Engineering, and he has done a certificate course in Innovation and Entrepreneurship at Pujo University in USA, and he then moved on and did Masters of Art in Design, Concentration and 3D Modeling from Turin in Italy, and then to Masters of Engineering, and then in Management Masters and Entrepreneurial Leadership he did from Bobson College, USA. So he is the first Indian who has won the Best Entrepreneur Pitch Award at YEA Brazil, which is of G20 countries. So he was the first Indian to bag this. Then Word's first stem cell baby, which was born to an Indian woman at the age of 45 years, that also was done because only his company was working in India, and madam was the clinician, and the baby was born on 16th April 2018. So
Just 2
now
days back,
Fogsi,
maybe is in India with us at present. Just 2 days back, she completed 7th year, and we all
yes.
celebrated together.
So he was awarded honorary fellowship also in 2025 AICOG. Then presently he looks after the Alive India, that is Regenerative Wellness Pune company. He is founder and CEO of that company. It is a state-of-art regenerative medicine and wellness clinic which focuses on autologous cell therapies and IV drip therapies. Pioneered engineering therapies for chronic conditions including diabetes, infertility, arthritis, and lung damage using personalized evidence-based methods. And Solo Stem Cells Pune, India, he is co-founder of that and founded this stem cell research vertical by bringing together a team of specialized doctors and regenerative medicine specialists in India, initiated pilot studies targeting kidney disease and diabetes. After initial success, moved on to research in the fields of osteoarthritis, Parkinsonism, autism, neurological degenerative diseases, stroke-induced paralysis, liver cirrhosis, multiple sclerosis, psoriasis, rheumatoid arthritis, infertility, and reproductive health. And he has also interest in pets also, and now currently he is founding member and director of Wingles India in Pune. So I welcome you, Rishi, with
Thank you.
your
Thank you so much for having me,
such a
ma'am.
heavy CV at such a young age. So
Thank you.
first
Thank you
of
Thank
so
you,
much for
all,
having
Poonam.
me.
I
Thank you,
will.
Poonam.
Okay, ma'am. Thank you so
Thank
much.
you, and I
Thank
will
you.
enjoy from the viewers link.
Thank you,
Bye.
ma'am. Thank you. Thank you. So, Rishi, first of all, I will just like to know the same answer to same question which I asked Madam, that aging and suffering. Aging is inevitable, but do you think many people today getting older with the suffering? So, it is almost synonymous with aging and suffering, synonymous.
Yeah, ma'am. Most individuals, it starts with a small thing when you say कि okay, अभी age हो गया है, अभी मुझे ये नहीं हो रहा है, and then slowly there are diseases that start setting in, and when diseases start setting in, mostly the chronic and lifestyle diseases, diabetes है, osteoarthritis है, these are diseases that have been around for so many decades now, that the perspective towards these diseases is also the same for decades and decades now. अभी शुगर बढ़ गया है, अगर if you're connected to a medical family, जरा जल्दी detect होता है. A lot of people don't detect it till very late stages also. Once it starts, then you take medication, then at some point of time you increase the dosage, at some point of time insulin. All this while comorbidities are forming, the blood sugar spikes are damaging other organs, and then eventuality is some fatality with some organ. And this is a way of life which people have accepted. अगर diabetes है तो अभी 20 साल अपना ऐसे ही होने वाला है. It is accepted. Nobody is challenging the root cause.
So
And that
but
challenge
how
is
can
not
we
there
challenge
because there may have not. Correct. So we are so customized to think of one disease in a particular way that we assume कि ये age के साथ जो हो रहा है, that will be suffering only. But by challenging is becoming more aware about why are these blood sugar spikes happening? How can we prevent them? Just in the case of diabetes, for example. For other things, there are so many very early signals and early triggers that if diagnostically understood beforehand, or if proactively thought about, कि okay, family history है, तो पहले से ही I should start taking care. A lot of times we take so many things for granted, our eating habits, our sleep cycles, our protein intake, our mobility and workout routines, portion controls in terms of our calorie deficit. So all of these things are getting taken for granted, which inevitably do lead to suffering. So by default, our tendency of associating aging with suffering is because we are not willing to make any major lifestyle change. We want to remain the same and we want to not have suffering. So if you take a slightly different perspective, कि aging तो हो रहा है, but how can we change? We can try to delay or prevent the suffering.
So इंडिया मुझे लगता है ना कभी कभी मतलब इंडिया आवर कंट्री इज लाइक दैट कि अगर कोई डायबिटिक है तो उसको मीठा तो खाना ही है लाइफस्टाइल चेंज तो दे डोंट वांट टू डू बट दे कैन हैव द टैबलेट लाइफस्टाइल चेंज नहीं चाहिए मतलब हिंदुस्तान मुझे लगता है ऐसा देश है कि अगर आपको अपना सिर भी प्रोटेक्ट करना है तो सुप्रीम कोर्ट हैज टू मेक द रूल के भाई यू हैव टू वेयर द हेलमेट आप नहीं पहनेंगे चलान के डर से पहनेंगे आप
True, true.
So
Very
what
true.
are the myths about aging you think? What is the myth you think, the biggest myth or misconception which we have?
So very similar to what you just said, ma'am. Ki we all know that prevention is better than cure. But whenever some new thing comes, we say we don't need it yet. जब जरूरत आएगी तब देखेंगे. So that is one very common way of thinking when it comes to any small or biggest thing. When say even when people start getting joint pains, आज हुआ 5 दिन नहीं हुआ परसों हुआ so it's delayed. The going to the doctor is delayed. The weight के related effect होगा तो वो proactively trying to lose weight is delayed. जब जाके वो जब तक वो हर दिन नहीं होगा तब तक it will not cause this thing. So we have this one saying that we use internally in our company actually, is that vitamins don't change user behavior, painkillers do. सबको पता है कि vitamins are beneficial for you, but आज लेंगे कल नहीं लेंगे, लेकिन जब पेन होता है पेन किलर जरूर रहेंगे,
वो तो लेना ही पड़ेगा आपको.
So some misconceptions are that कि prevention is not possible. अगर फैमिली में डायबिटीज है, ऑस्टियोआर्थराइटिस है, some of these conditions, what we say hereditary है, it is not compulsory कि you will get it in the same way, with the same intensity, with the same at the same age. We are seeing younger people, 30, 35-year-olds get diabetes now. But if you have a family history, prevention is more important. And prevention should happen in the smallest and biggest ways from the teenage years. Because the diabetes that comes in our 60s starts in our 20s. The osteoarthritis that leads to a knee replacement in our 60s and 70s starts in our 30s and 40s. So the biggest misconception is that I have time. I have time, I will fix my sleep, I will fix my food, I will do all of these things and I will change.
And which I
Everything
will
else
never
we'll see
do.
later. Yeah,
So that means we should change our thinking, like from increasing to lifespan, we should move on to increase our health span.
correct. Correct. Health span is what is coming more and more focused because medicine and allopathy in the last 20, 30 years has advanced enough to get people out of critical situations to help them live longer, longer, longer. But I have seen with my grandmother, we made her live till her 80s. But her last 15 years of life was not a great quality of life. She was just at home on her own, mobility नहीं है, दिन भर घर पे ही बैठ के काम करना है. That is not quality of life. So, if her health would have been in better condition for those last 15 years, then it would have been a much better way of living for her. So, it's just not just adding more time to the years, it's adding more life to the years as well.
So, do we have any scientific way to measure our age? Like, actually, if maybe ऐसे लगता है ना, कभी कभी आप किसी से मिलते हो, "वही तुम्हारी एज तो इतनी लगती नहीं, किसी की
Correct,
लगती है."
correct.
So, कोई scientific measure do we have?
So, we do, ma'am. There are a lot of very advanced diagnostic tools available now to help us identify what our biological clock for each organ looks like. And it's a relative
Okay.
scale based on research. And it's like a saliva test or some can be blood tests even. So they factor in not just your genetics. Sometimes genetics, of course, has a major role to play in your process of aging, but epigenetics, which is the impact of our environment on our gene expression, is also a very important factor. So there are some epigenetic and genetic tests available which will tell us कि this is what normally your biological age for your say heart should have been like, and this is where you are in that range. One very important other metric that is coming up is our telomere length testing. Telomeres are the ends of the chromosomes. Most doctors are aware telomeres का length with age कम होते जाता है. Now we
Okay.
have enough data to test and prove कि this is the rate at which it should happen normally, and you can test and see are you at the right thing for your age or are you going faster than your age? And there are many tools available to slow it down as well.
Okay. So, what are those tools to slow it, like stem
So
cell or what?
it's like a pyramid. There are some fundamentals at the base of the pyramid that you have to look at. Nutrition is very, very important. Protein intake, preventing blood sugar spikes, getting enough antioxidants, minerals, vitamins. Then comes mobility in that same protocol. We end up sitting 5, 5, 6 hours on a chair without even realizing. But that is doing damage to us. Earlier, we used to just sit on a chair, which was okay. But now we're sitting on a chair on the laptops. We're sitting on a chair on our screens. So posture and mobility coming together. All of this ties in with your stress levels. Now, stress hai, sabko hai. But
Yes.
how do we minimize? We have to figure out breathing exercises, yoga, just cutting down some screen time, there are basic 2, 3 breathing exercises which you can do sitting anywhere, which can help you bring down the physical impact of the stress. So some of these are the base of the pyramid, which you have to factor in. अगर आप ये fix नहीं करोगे, so using the most advanced and modern age things where your base is only not okay, it's not going to have an impact. And then the more advanced things, there's IV therapies available. There's some cryotherapies and cold plunges available. There's ozone therapies available. There's stem cell therapies available. A lot of regenerative therapies, which push your body's cells to regenerate better, are available now, which can really help slow down the impact of aging.
So, we do stem cell treatment now, preventive also. have we started doing it in India preventive, or once we are suffering from some disease, then only we can do?
Primarily, as of today in India, most people are not aware about the preventative side. So, a lot of centers that are doing cell-based therapies in India are focused on specific diseases because the need is for the diseases. Slowly, slowly, though, how and when this mindset starts changing towards
Okay.
preventative, everybody can start doing cell therapies in a preventative way. And many countries across the world, in Japan, in Dubai, in Singapore, in few of the Central American countries, a lot of places, preventative stem cell therapy is also being done. And we do have individuals who come into Alive, they actually fly down to us from wherever they are because the cost of doing it in India is much cheaper. And I think India has a great advantage in that way where many centers can come up to do these cell-based therapies at a much cheaper cost because our doctors and our clinicians are great at what they do. They have the resources, they have the ability to do it. It's just that as of today, agar demand nahi hai, so then why will a doctor get into it? Even for us, when we got into it, when we first explored it, it was because my grandmother, Nani, needed stem
Okay.
cells to regenerate her kidneys. So we went into it. Then we started doing research and did for 50 other things. But never would we have thought कि 50 years old कुछ भी नहीं है तो
कुछ
let's
भी नहीं है
explore
तो
something
करें,
different.
हाँ.
But cell therapies are coming up now in a preventative way. Uh, and they are shifting from one side is curative. चलो disease है, condition है, कुछ तो
करना
करना है
ठीक
उसके
है.
लिए.
हाँ.
One side is purely preventative.
Preventive. Okay.
But there is a in-between segment which is sort of like a lifestyle thing. It is supporting my lifestyle. I have stress. I know I'm predisposed. I know all these things are going on, but I'm not being able to balance that in my lifestyle. So let me take use of some regenerative things which will at least help me support my lifestyle.
Okay. So, is the our government is supporting all this, or can we do this, or special permissions or something is needed for all this?
So for anything autologous, ma'am, in the recent 2, 3 years, the government has started changing its stance towards more supportive. A lot of
Okay.
autologous related applications have been, okayed to do. Anything that requires any sort of modification of the stem cell still classifies as a drug. And then it has to undergo the whole process of it, going through a drug approval. But there are newer inventions that are coming out in the stem cell space. There is a new type of stem cell called Muse cells. One scientist in
How do you
Japan has
spell it?
discovered MUSE, Muse cells.
Okay. Okay.
It is a derivative of mesenchymal stem cells. Scientists in Japan discovered it in 2010. And it's actually a cell where I can use yours as well. HLA typing is not needed. Immunosuppression is not needed. And
Oh,
these cells have an inherent quality to identify damage in the body. So आपको diabetes issue है, also you can just inject it IV. आपको neurological issue है, also you can just inject it IV. As of today, the practice is if it is something, say orthopedic, I have to give intra-articular. If it is neurological, I might have to give it intrathecal. But when these newer cells and newer technologies are coming in place, everything can be done in a very, very minimalistic and just an IV saline sort of route as well. So government is not full-fledged with steam processing all the way ahead, but at the same time, we've been in this space for the last 10 years now. So first 8 years were very different. Last 2, 3 years have been very different. So progress is going towards in the right way.
but what you are saying, like these muse cells and other things, and the way if government allows everything like this, so what will happen with time? There will be silver tsunami. You will be having a older population sitting everywhere. So what will happen to our population?
So I think in the next 15 to 30 years,
Uh,
all the people who are in their 20s and 30s now are going to start becoming in their 50s, 60s, 70s.
yeah.
So these are the guys who are very well aware about what is happening with their future. They don't want to live the life that their grandparents have lived. But about the people today, the people in their 50s, 60s, 70s today have to start with the basics. The basics are fundamentally not right because this generation of the individuals in their 50s, 60s, 70s, they are the first and second generation entrepreneurs. They have seen the struggle and they have
Mm.
neglected their health for a very long time because family
Yes.
के लिए करना है, stress levels है, career wise ambitions are also there. A lot of change in technology that has happened in these last 20 years. So this age range of people, I think will, if the mindset changes कि okay, we should not accept कि 60s, 70s में मेरे को retire होके I physically will not be able to do anything. If you just change the mindset, there are a lot of tools available today to help you really live a full and healthy life and help you perform the same way you did in your 40s and 50s, even in your 60s and 70s.
So I remember once I was with my some elder colleague, very senior one, my mentor, and धीरे धीरे चल रही थी वो, कुछ कर रही थी, तो मैं दौड़ के गई, मैंने फटाफट उठाया, तो देन शी टेल्स मी,
Hmm.
कोई नहीं, अभी तो 60 में चल रही है ना, थोड़े दिन में 70 में आएगी तो बात करना.
Yeah, yeah, yeah.
So it is like that only. So, another thing I would like to say that mental health management is also important in these geriatric patients, because every time I think they are emotionally disturbed. They don't understand the life stresses now the younger generation has, the working hours and everything. They don't
True,
understand. They only think that I have cared for them, but they are not caring for me. So there is a
true,
lot of emotional disturbance also. Do you feel it is so?
true. I think so. I think so. But if I remember my Nani as well, in the
Mm.
last 3, 4 years of her life, she had
Mm.
started using WhatsApp. So
Okay.
anyone from anywhere would quickly call her on video on WhatsApp, talk to her for 5, 6 minutes. So she used to try and keep herself occupied that way. And I genuinely feel that the older you are,
Mm.
because the biggest thing that a person feels, what we have understood, is that loss of independence and physical ability. Ki you are always dependent on someone else
On
to do
the
something for you. And if in your prime, in your 30s and 40s, you have been the person who has managed everything for everyone, and now suddenly you
yes.
feel that you're
Sudden.
dependent, it's mentally it's a challenge to even accept it. Second is the physical part. We can't move around as much. We can't do as many things we can. As much as the older generation does not fully understand what the younger is going through, the only thing I think they require from the younger generation is time.
Time.
There is nothing else except that they really expect. But now technology has facilitated it enough to connect people, to be more accessible to talking, to reaching out, and at the same time, even artificial intelligence will sort of come into play here, where for basic small things, the support can be given by artificial intelligence. But that time factor and that emotional connect that only family can give, that will always, remain a question mark. But the millennials are the mid-range age group, but the Gen Z guys, the guys who are in their teens right now,
Mm.
they are
Mm.
well aware of this because they have seen the grandparents suffer a lot more because they're at home more. They've grown up around grandparents. They've understood
Yes.
the functionality and they have that emotional connect. Parents are busy, okay, but grandparents and grandchildren have that special connect for a particular reason. So yeah, mental health focus of the Gen Zs is a lot, which is why they also empathize a lot more with the senior gentry, and geriatric care should also have a major mental health focused impact. And
So,
somewhere we connect this, ma'am, sorry to interrupt, somewhere we
mm,
connect this to your body. What
mm.
you feel in your mind manifests in your body. What you manifest in your body manifests in the mind. So, with a lot of these new age therapies, new age diagnostic tools, some technology combining as well, if it's helping your body feel better, your mind and your emotional state also gets better.
So, what are the early signs if someone can identify? What could be the early warning signs of aging, which people usually ignore?
Uh, the two, three things that we are seeing very commonly happening now is there are some physical ones and there are some mental ones. In the physical ones, everybody is starting to get a tummy. Most working professionals are not as focused on their health. Eating habits are deranged, sleep habits are deranged, but the impact that is visibly seen is that slight weight gain. Slight weight gain 20 years ago could have been taken not so seriously because people were more active, moving around more, doing more things. But even the slight weight gain today, if your body has put on just a couple of kilos suddenly,
Hmm.
it should be checked. It should be looked at quite seriously. And everything then needs to be looked at together because today the cortisol levels are getting disrupted. Your normal hormonal function, the ghrelin levels, leptin levels, melatonin secretion, and cortisol, it's all a cycle that happens throughout the day. But our sleep is not the same, our foods are not the same, we don't get sunlight, our brains are overstimulated, our stress levels are much higher. So this whole disruption happens. So some people just power through it, saying, Karna hi padega, there is no option. Whatever the stress impact, whatever the body impact, we power through. But just if you start listening to your body a little bit, because your body is constantly talking to you. If you're constantly feeling hungry even after eating, that means something is wrong. There is a reason why you're feeling that. If you're sleeping and still waking up tired, something is wrong. There is a reason why you're feeling that. So these two, three small things are sleep and uh, appetite regulation are two very basic things that we foresee as early signs nowadays.
So, according to you, if some younger colleagues are seeing the program, so when should we start all this? At the age from 30s or from 40s?
So technically, ma'am, we start aging the day we're born, right?
Yes, yes.
But chalo, our bodies are functional. Our
Uh,
our bodies are capable of doing a lot more into our teens and early 20s. Depending on where and when your mobility stress levels are starting to get affected, if it's
mm,
happening at the age of your 2025s, you need to first start fixing that base, the nutrition, the food, the mobility, XYZ. If all of that is in place and on point, then maybe you can delay it into your 30s into adoption of some of these new age things. But the diagnostic should start happening as early as possible. So tracking your sleep metrics, tracking your stress levels. There's one important metric called heart rate variability. It is basically when you're asleep, what is the frequency in which your heart rate is varying? The frequency should be very less. Matlab the variation should come over larger periods of time. So the higher that duration between variation, the better you're recovering. But all these factors that we mentioned, the food, the stress, the XYZ, hormonal dysregulation, they reduce your heart rate variability. So this heart rate variability factor should be tested from in your 20s and 30s as well.
so
And the
should not
second thing
it
is blood
be?
sugar spikes.
Oh,
And we have a
so
lot of people now who are wearing those CGM monitors even in their 20,
yes,
25 because they
yes.
want to identify
Uh,
which food is triggering. And it's not something you have to wear for life. In a
mm,
year, wear it for a month, reset
mm,
your routine, and
mm,
then take it off.
mm. So, when we are saying that we should age gracefully or we should know all this, so should there be some, some coaches for this, some lives aging skill coaches, something like that? Is there any
There are,
concept?
man. There are,
There
there
are.
are, and there are quite a few guys.
Uh,
It's a lot of guys who have properly studied and understood fitness and nutrition, who
okay.
are sort of transitioning to
Marcus.
become lifestyle-based coaches. And not everybody is going to be able to do everything on point.
Mm,
But step one is awareness. You
mm,
don't need a coach necessarily to come and figure it out for you. some basic things we also know in our day-to-day we are taking for granted. So self-awareness is step one. From self-awareness, then step two is optimization of small things first. And then when you want to really, when you've gotten yourself from bad to average or good, then to take you from good to great is where clinics like Alive come in, these fitness and nutrition guys come in. Medical expertise is important. You can't have that support without scientific and medical expertise. So eventually we will see a rise of more and more of these health, uh, not just clinics, but zones where you have multiple doctors on board, you have multiple nutrition, sports related, overall stress management related, yoga related, multiple things will have to come together for it to then be a lifestyle related thing. Ki one place can then guide you and coach you into a routine which you can then maintain.
So was you yourself overweight sometime in your life? Was it?
So I'm 5 feet 6.5 or
Mm,
something like that.
mm,
My ideal body weight should be somewhere around 60 to 65 with proper muscle
mm.
mass. I've always been in the 58, 59 range.
Okay.
And there's this one period of time after my
Yeah.
ACL ligament tear surgery, post
Okay.
which I put on weight and it went to my highest touch wood has been about 66. And
Only.
when I saw 66, I got scared. Because in my head, growing up around doctors, growing up around Nani's diabetes and everything, I
Mm.
knew ki obesity is linked with diabetes. So that 60 to 66 6 kilo gain in that 6 month time frame, and this is I think 10 years ago now,
Okay.
was the wake up call for me, saying
Okay.
it's not. I have not worked out. I have not done anything. ये बस fat percentage बढ़ा है, and that was a trigger into getting it. So like I said, it's an early sign of weight combined with some small general things that we take for granted, which we sort of start becoming self-aware. So I took cognizance of that time itself, and I started doing research. I was in the States at that time.
Okay.
And when we started doing this research, we started finding a lot of these IV therapies are there, few other things are there, which can help you accelerate getting back to your ideal self.
So, what I was searching on Amazon, that NAD, that is nicotinamide adenine dinucleotide, that is
Yeah,
available in India also. And
it is.
I'm not very sure, but there are various formulations, like there are capsules also, like there are subcutaneous injection, pens,
Right.
then IVs. So, I don't know personally, I have never used. So, just let us know about what
I'll
you know.
explain. I'll explain.
Uh,
So NAD plus our body makes naturally.
Okay.
It's a derivative coenzyme that our body makes from vitamin B3.
Three.
Okay.
Okay.
B3 breaks down 7, 8 processes later. It eventually makes NAD plus, NADH, NADPH. But you
Okay.
cannot control which one of these elements it's made the most.
Acha.
So the more the the levels of NAD, they are supposed to decline with age. They pretty much half every 25 to 30 years. So if you're born with 100, by the time you're 25, 30, 50%.
Mhm.
By the time you're 50, 60, 25%, half
Mhm.
होते जाता है. So in the last 10 years or so, people have started identifying because NAD plus is a crucial element for ATP generation and electron chain transfer in all our mitochondria.
So
So
it
NAD का
gives
level कम
energy.
जा रहा है.
Mm.
It helps manufacture ATP.
Okay.
It is the final step of the process before ATP. So before NAD plus is there, uska one step before precursor is NMN, which is available in oral form. 2 steps precursor is NR, nicotinamide riboside.
Okay.
So what became popular in this initial uh, years when NAD got identified is
Mm.
people said, okay, let's take the precursor. So our body doesn't have to go through 8 processes to make NAD. ये precursor लेके एक
Only go
process, दो
to
process में होता है.
process. Okay.
When you
Right.
take it orally, according to recent research, oral only raises your peripheral NAD levels, not your systemic NAD levels. So many people who have taken NMN or NR. NMN is better than NR, but for some people, NR can also work. It does not give you that impact of elevated NAD levels. If you do a blood test will show NAD levels are more, but you will not really feel anything.
Okay.
That is where the injectables that got introduced. When you take NAD IV, it works on increasing NAD levels systemically as well. And you
Okay.
really see that impact, that energy driving up, your hormonal function starting to regulate, cortisol levels going down, sleep quality becoming better, your energy levels and vitality through the day, not just you being able to stay awake for 18 hours. You be able to function with prime efficiency for those 10, 12 hours also starts going up. So this is where the injectables came in.
Okay. So in India, that pen is available?
In India, the pens are not yet available where you
Okay.
can give yourself subcutaneously. As
Uh,
of now, I don't think, at least we have not found any reliable source of manufacturing in India. And globally, there is almost always a shortage. So we work with 5, 6 countries, depending on whenever we need the supply, we order from there.
uh,
Uh, and so people need to take it in the IV form in the initial parts to get their levels high enough quicker.
but वो
Also
IV
systemic NAD
form भी
levels.
not available नहीं है ना इंडिया में तो नहीं
Not very
IV.
commonly available. We have to get it from outside. We have to get it from outside.
So how do we get it from outside? Like anybody can have it or some
No,
research
so we
purposes?
have we have we have spent almost three before we introduced NAD as an IV, we spent 2 years finding the right supplier.
Oh,
Then getting all the documentation in place, doing testing
uh,
of their third-party testing of their quality of NAD, all of
okay.
these things. Across the world, NAD is not something which is like an FDA approved thing or a painkiller that can be prescribed for a certain condition.
Hmm.
In some countries, it's a prescription drug. In some countries, it has shifted into the wellness domain. So it depends on the application for it. NAD is not just something you take for overall vitality. When we got into NAD, our intention of doing NAD was actually for Parkinson's and for ovarian aging. And we have some case reports where we have seen AMH increase after taking NAD, which is, I mean, even for ma'am, when I had shown her the documentation and asked her to start doing research in this space, she was like, we don't know as of now, AMH is not something that can increase. But now we have started
That is
seeing
what we know.
one. But we have started seeing physically in clinic documented cases where we have seen sporadic cases where AMH has increased. In some cases, it's the quality of the follicles that has increased. AMH has not really changed as much. But fertility aside, neurological impact, brilliant
Hmm.
results with NAD plus. Overall vitality impact, brilliant results with NAD plus. We have had some people who have been a little bit older in their 70s who've taken NAD and who've come back and said that, okay, I feel my eyesight has become better. Now, uh, everybody, all of these guys are made fully aware that, okay, this is something we're trying, it's going to help in this way, but we're not sure of the implication. But it's a B derivative vitamin, excess is flushed out. The dosages are very controlled. Your body is tailored to it. The protocols are set. So people, even doctors who have taken it with us, have seen great benefits with NAD. So IV and injectable is the right way to take it if you're starting up with it. And then there are versions available which are just shots as well. So you want a maintenance dose, just like you take a B12, D3 shot, the levels drop ho raha hai, aise lag raha hai. There are tests to do it. Unfortunately, there's no test for NAD plus levels in India today. In the Western countries and many other countries, it's a routine blood test that people do.
So how do you, as a young entrepreneur, how do you see the scenario of all this in India in coming 10 years or so?
So I see, ma'am, that in the last few years, a lot of entrepreneurs who are not doctors or not in the medical space have focused a little bit more on technology related
Mm.
stuff in the healthcare domain. But now I think the focus is shifting a little bit into more service and therapeutic applications as well, and proper products Nutraceutical, though, the whole industry has come about
Ah,
and there's tons of things
there's
available.
too much.
Some are genuinely doing it
Mm,
properly, some are not doing it
mm.
that well. So there is need for the entrepreneurial community to get involved directly with the doctors and the scientists directly, not just based on a research paper. On ground, real world things, testing, pilot studies need to happen collectively. And through this way, there is a lot of scope for very specialized cell therapies, very specialized IV protocols as well, a lot of other alternative therapies. So regenerative medicine, I always say, it's a completely different pillar of medicine. Just say there is homeopathy, Ayurveda, allopathy, and they have their own place. They have great impacts. It's not like this is going to take away from that. But it's regenerative medicine is one more such pillar that is coming in, and collectively, people have to figure out what works best for them. Some people choose, okay, I don't want anything allopathy, I just want Ayurveda. Great, if it's working for you, nothing like it. Some people say, okay, I don't want Ayurveda. Allopathies, I know I've had a result, let me stick to that. Thinking is different. Similarly, now regenerative medicine will come up as a brand new pillar. It will be a dedicated field of expertise that sort of comes up. But the initial push will have to come from doctors and scientists coming
Doctors
together
only.
with certain entrepreneurial guys who are able to
Push.
really take it to market,
Mm,
because doctors are busy in their practice and rightfully they should be. They don't have the time to understand ki, how do I help other people become aware about this? How do I help them? So that's where the business side of things come in. And I think there's a great scope for that. And India can. The reason why we actually won the G20 prize, the pitch award in G20, was we showcased some of our results. We showcased some of our case papers
okay.
and the sheer and it's documented data, right? It's not fabricated. It's all the blood tests, everything that we have ourselves that was presented, not just third party research. That was one main reason why. Because nobody out there has the connect to sit with scientists and doctors and to spend time doing this
You
research.
spend them.
And
So
on
that
the
way you
other
have
side,
advantage.
yeah. And on the other side, unless you sit with the scientists and the doctors, you will not even know the real world problems.
Mm,
You can't just sit there think कि ये लोगों का issue है तो इसके लिए हम कुछ करते हैं.
ah,
So
right,
this
right.
culmination will be
So
where India takes it
when
forward.
you left your successful career in US and you came back to your roots, so was that decision difficult for you? Or it just one day you thought, no, I have to go back and do.
So my decision, I always wanted to come back to India. I knew
Okay.
that even when I left. Mom and dad didn't expect me to come back. They were like, you're choosing to take a
चला गया
non-medical
तो चला
field,
गया.
so जो करना है आप करो. But midway, when I was doing one of my that masters in automotive design,
Hmm.
we were starting to explore stem cell applications for Nani. And when I saw the impact of that, and when I saw the results that we were getting, the entrepreneur in me always wanted to do something
Ah,
on a social side of things,
okay.
you know. So I was like, this is something where we can bring social benefit as well while creating something that can really last and change the way
Changed.
healthcare is approached.
Absolutely.
So
Oh,
while I was doing that, then the next 3 years of mine in the States, the masters in entrepreneurship and everything was always with the direction that at the back of my mind, ye stem cells is what I want to take forward. So all
hmm.
my discussions with my professors, my core pilot projects to discuss with them was all
Hmm.
tailored towards, okay, this is what I'm going to go back
Yeah.
to. How
Okay.
and what I'm learning here going to help me over there.
Okay.
So I don't think it was a very difficult decision. I was more than happy to come to India. And
Uh-huh.
it goes back to what we were talking about, that geriatric care and how that time
Yeah.
aspect is there.
Yeah.
That, parents have done so much for you from
So
scratch,
much.
spent so much time,
Absolutely.
effort, energy. And being the only son, I wanted to come back and be here with them.
So you
So,
miss a sibling?
yeah, yes, I think so. I would have loved to have
Your next
a
generation
sister.
should not miss. Huh?
Yeah, 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 definitely.
So, vada pav, pizza or macaroni?
Hmm.
Vada pav
Pizza.
pizza, not vada pav.
No,
So,
white bread is something I will stay away from.
so you are mama's boy or daddy's buddy?
Both. Can't separate.
Okay, so who is aging more gracefully, mom or dad?
Uh, uh, I think mom,
Okay.
but I
Who
think
has
dad
got
is
the
doing a lot more in terms of mobility and workout. Mom is aging more gracefully considering the amount of stress and 100 things that she's doing. She's still managing everything together.
uh, yes. And I think her leadership qualities are also, I think, makes her stand out.
No,
So
I agree.
most,
Sometimes I sit here think and I don't think I can even do 50% of what she's doing at her age. Your generation is built different.
so most wildest myth you found about aging.
Uh,
किसी ने
wildest
कुछ
myth
अजीब
about
चीज
aging.
कभी, हाँ, या किसी ने कुछ अजीब चीज बताई हो, बोली हो about aging.
A lot of people come in with the expectation of 100% cure. You know,
Okay.
if there is anything that is there that they're suffering with, their reason and the incentive of taking an action towards it, be it through our center or even visiting any other doctor, is कि will it cure? 100% जाएगा क्या? और
हाँ.
आपके आपके थेरेपी से जाएगा क्या? We are not going to do anything. So that is a major myth because at the end of the day, everything is rooted in your nutrition and some lifestyle changes. So the concept of it feeling कि आप जो दे रहे हो उससे होगा तो कर रहे हैं नहीं तो फिर नहीं, that is a very common thing that we see.
ये कुछ that is ना built in Indian psyche only, I think. कि मतलब they don't want to think, sometimes I tell to my patients, भाई कैसे आप पोलर का पंखा हो क्या कि आपको 7 साल चलाना ही है मुझे, आपकी मोटर खराब हो गई तो दूसरी डल जाएगी, यू आर नॉट
Yeah.
पोलर का पंखा भाई, इंसान हो,
Yeah.
हम कोशिश कर रहे हैं ठीक करने की,
Yeah.
बट
Yeah.
वो कुछ इंडियन कल्चर ही है जिसका कुछ नहीं हो सकता.
It's changing. It's changing though. The younger generation is changing it.
हाँ.
And it's the younger generation that is going to drive the future, the slightly older generation to also change it because it's a little bit difficult. There's always a question कि हमारे जमाने में ऐसे नहीं होता था तो हम वैसे नहीं
हाँ.
करेंगे. But
Yeah.
zamanas have changed now. Everything has changed.
Everything has changed. Yes. So it was so wonderful to talk to you with Rishi. So
Thank you. Thank you
anything
so much for having
last
me.
minute message if you want to give to.
The last minute thing is one of those sentences that I said before about the vitamins don't change user behavior, painkillers do. That's a very deep line to understand. And at the end of the day, it comes to us becoming self-aware and knowing what is working for our body, what is not working for our body. But fixing the fundamentals and not taking the fundamentals for granted is very important. The sleep, the mobility, and the nutrition. Three fundamental pillars that even more so as doctors, that all the individuals who are listening who are doctors need to take care because in the midst of your patients, in the midst of your surgeries, in the midst of your families, managing so many things, you neglect your own health.
Yes.
So somewhere you need to keep everybody aside and try to give dedicated time for your health because that is in the long run going to help you be there for your family, help you be there for your patients, help you be there fully for yourselves. So one thing is
Absolutely.
doctors are the pall bearers for health, but they neglect their health. So you guys need to really take a pause, think what is the right thing to do for my sleep, what is the right thing to do, and really start implementing that, not at the cost of your health.
So thank you, Rishi. It was
Yes. Thank
so
you. Thank you so
nice
much
to
for
talk
having me,
to you.
ma'am.
Thank you.
Yes.
Thank you.
See
Thank
you.
you so
Bye-bye.
much.